Hi, everyone. My name is Ellen Holmes. I'm a respiratory therapist and educator with the Lung Health Program. Today, we're here to talk about flare-ups and action plans. So everybody knows that we typically get a cold or a chest infection at some point. That's all part of the process. The thing is, what we need to do is take quicker action in getting help. So that's what this talk is all about today, is recognizing when you're having a flare-up and when to actually do something about it. So bear with me while I load the presentation, okay? Just gonna share my screen. And away we go. So flare-ups and action plans. First of all, we're going to talk about what is a flare-up. A flare-up is also referred to as a lung attack, and many healthcare providers, including us, unfortunately, sometimes will use a big word by it's called exacerbation. It's pronounced exacerbation, as you can see below. So what this is a sudden change in your breathing patterns. It's and symptoms. It's beyond the normal day-to-day variation. So you may have cough when you don't have a cough normally. Your cough may become worse if you do normally have a cough. Again, you may produce mucus. If you don't normally produce mucus, then when you're starting to produce mucus, something's different, something's changed. The color, the thickness, the texture, the odor often of the mucus will be an indicator that there's something brewing. If the mucus is yellow, green, or brown, it is usually a sign of an infection and requires help very quickly. If you find that you're more short of breath than usual, all of us are short of breath at some point, but some may become more short of breath with a lung attack or a flare-up. You may feel really, really tired or have extremely low energy, and that may be the only symptom you have. So these are all things to watch out for. Fever, chills, anything like that may indicate that you're becoming ill. Action plans are here to help us. They're helping us recognize the early signs of a flare-up, because the idea is to get help as soon as possible. We really, truly don't want you to wait more than 2 days before you start using your action plan in the yellow zone. So there is a common thread, even though action plans may look different all over the place, all over the world, as a matter of fact, they all have a common thread. The common thread is they have a green zone, which is safe zone. This is your normal zone. They have a yellow zone, which is caution, not unlike a street light. And this is where things are changing, when things are getting worse. So we need to be really cognizant about our symptoms and recognizing them and actually doing something about it, rather than waiting at home for 2 or 3 weeks before you call your primary care provider. And the red zone is, as a stop sign again, stop. You need help. You need to call 911. You need bigger guns for your treatment, and you need more help. So that's typically what action plans will look like. Bronchiectasis is on your left, action plan for COPD is in the middle, and asthma action zone is on the right. And they do all look different. Pediatric will be different from an adult. They have more pictures on them so the kids can understand them as well. So green zone is when everything is your normal. It may not be perfect because it is a chronic lung disease that you're dealing with on a day-to-day basis. You may feel short of breath with exercise. Again, that's normal. You may cough. These are your typical symptoms. Usually the color of mucus is white, but your norm may be yellow, or your norm may be another color. To stay well, we use all of our medications and inhalers as they're prescribed. If you don't feel you have mucus, use your airway clearance devices if you have them, because it will still help with trapped air and clearing mucus and getting the mucus up out of the bottom of the airways and into your throat, so that you're able to cough them up and out. Avoid known triggers. If you know the triggers that bother you, like strong scents, diesel fumes, smoke, etc., then try as well as you can to stay away from them. Maintain a regular exercise routine is really important for all of us. All of us should be getting 150 minutes of moderate cardio a week. So moderate to severe or hard cardio a week. So keep up that exercise, really, really, really important within your means. And you can talk to any one of us about that. Yellow zone is the caution zone. So when your symptoms are worse, then that means you're in the yellow zone. If you have more symptoms than usual, or if your symptoms change, it's really important to monitor this and call your primary care provider if you need to. They may have provided you with antibiotics or prednisone or prednisone. You should know when to start them and how long to use them. Make sure you follow up with your provider after you have started your flare-up medications. Sometimes a yellow zone might just be an exposure to a trigger, in which case, down at the bottom, we would, or almost middle of the page, basically, we would recommend that you take your short-acting bronchodilator, which could be Ventolin, salbutamol, Bricanyl, any of those devices, to help with your shortness of breath. We would ask you to take that, and hopefully that will switch you back into the green zone. If you need the antibiotics and prednisone, you have the prescription, go ahead and take it if your sputums are discolored according to what your physician has discussed with you. And hopefully that will clear things up and again, put you back into the green zone. If things are not better within 2 days, again, 2 days, then you need to contact your family care provider or go to the hospital. And we prefer that you not drive. We prefer that you call 911 or have someone drive you. But honestly, 911 is the best way because they can treat you along the way. And they will also line you up in Emerge quicker than if you walked in. So don't hesitate. It does cost a little bit of money, but it's worth it. If it's a false alarm, it's still worth it to get the care that you need when you need it is the important thing. Preventing flare-ups is really important too. So red zone is when things are the worst. It's very severe. Your breathlessness is not going away no matter what you've tried in the yellow zone. You might have chest pain. You might be confused. You might feel drowsy, lightheaded. If you have a monitor at home and it's low, it could be low. And as I said, within 2 days, if it's not better, you are definitely in the red zone and need to get more help from a hospital setting. So how do we prevent flare-ups? Well, a big one is take your medicine. I know all of you are really good at taking your medicine, but maybe not so much at taking it every day. So it is critically important to keep the airways healthy and free of mucus and infection. We need to take our medication every day as prescribed. Exercise regularly is so very important. Just simple walking can make a huge difference in many things in our lives, but especially in our heart and lungs and our brain. Keep staying smoke-free, eat right, get enough rest. Sleep is, I think, has been underrated for a very long time. It's really critically important for us. Use your breathing techniques that we'll share with you and or airway clearance techniques, again, that we'll share with you. Vaccinations are critical. Flu shot, pneumonia shot, Prevnar 13, if you qualify. COVID vaccines, of course, are very important, but please do try to stay on track with your vaccines because these are exceptionally important with people with lung problems. Staying away from people who are sick is the biggest one and a really common problem, especially in seniors with grandchildren. When the grandchildren come over to visit, then often the seniors get sick, even though the grandchildren just have a runny nose, and they're fine. But the person with chronic lung disease doesn't fare so well. So try to curb that visitation to other days when the children are feeling better. Washing your hands properly and often and trying not to touch your face is really important as well. Identifying the things that make your breathing worse and manage these triggers, staying away from them as much as possible. Preventing a flare-up, washing your hands. This is the technique. I'm sure you've seen it in every doctor's office, in every family health team and community health center, at least for 15 minutes. Warm water, well, hot water if you can tolerate it. Lots of soap will bust up most viruses. They just can't survive in that environment. It's the best thing you can do for your personal respiratory health. Another thing we can use that we've been using is waterless antiseptic, so Purell and things like that. And it's basically the same thing. Applying it, rub the hands together, rub between and around your fingers, rub the back of each hand with the palm of the other, rub the fingertips of each hand in the opposite palm, rub the thumbs around and rub it in until it's dry completely. Yeah. So your circle of care, you're the most important person in guiding your healthcare. It's your body, you know what's going on, and you can express it the best, far better than anybody outside you can understand. So make sure that your family and substitute decision makers know that you have COPD and know where the action plan is, preferably on your fridge door. So it's a reminder every day to A, take your medicine, and B, if things change, if you're approaching the yellow zone, that you'll know what to do. Your primary care provider, doctor, nurse practitioner are all part of your team. Respirologist, cardiologist, all other specialists, your respiratory therapist, respiratory educator, we're there for you, pharmacist, physiotherapist, and chiropractors, any other care provider, they're all part of your team, and they all should know that you have COPD and care for you appropriately. The ones that, yeah. When you go to meet with your team, be ready. Have a list of medications in your purse or your wallet for every appointment that you have. Ahead of time, it's a really good idea to write down questions. Put the questions the burning questions on top, so that if you don't have time to get through all of the questions, at least you'll get the ones that you really, really want answers to first. Ask a family or friend, or friend to come with you to help you understand what the physician or clinician is saying. This always gives you a second perspective, a second set of ears, and they might hear something that you didn't, and they may be able to take notes that you may not be able to because you're focusing on the conversation with your provider. Think about if your symptoms are stable, worse, or better. If you have any concerns or questions about your current treatments or symptoms, and also ask what to expect in the future relating to your health conditions. No one can predict exactly what's going to happen, but we can probably give you a pretty good idea. So tips for a successful meeting with your team: if you don't understand what's being told to you, ask for clarification. Ask the physician to write it down, just jot it down on a note. Be honest about your health. If you use marijuana or other medications, tell your doctor, tell your provider. If you're unsure that you're taking your medications properly, ask for a review. Ask about programs in your community. There are lots out there to help you in many things that will help keep you active and healthy. If you get home and realize that you missed a question, then by all means, call back. You could speak to a receptionist or a admin assistant, and they can ask the clinician about the question, and either the clinician or the receptionist can get back to you. And that's it. So I'm going to stop sharing my screen. And we'll talk to you real soon. Take good care, everyone. Bye-bye for now.